This is a wisdom teeth consultation video for patients over the age of 30. You are here for a consultation to evaluate your wisdom teeth. These teeth are typically located one in each corner of your jaw. Are you currently experiencing any pain or problems with your wisdom teeth? There are several important risks and complications to review. A. Delayed healing. B. Periodontal defects. C. Nerve injury. Loss of sensation. Timing of removal. For wisdom teeth, the ideal time for removal is around 15 years old. Why? Because at 15, the roots are not fully developed, which makes removal easier and healing faster, often in just a few days. In contrast, by the age of 20, it may take about 2 weeks to heal. By 30, it can take 3 weeks. By 40, 4 weeks, and so on. The point is, the older you are, the more complex and prolonged the healing process becomes. Periodontal defects. Another problem with having wisdom teeth removed at a later age is the risk of a periodontal defect. Before the age of 25, almost 100% of the bone typically recovers fully to its original height. After 25, there is a higher chance of a residual defect or periodontal loss behind the second molar. Nerve injury risk. The third concern with delayed removal is the risk of nerve injury. There is a nerve that provides sensation to your lips, chin, tongue, and teeth. It runs inside a canal in your jaw on both the right and left sides. It affects sensation only, not motor control. So it affects how things feel, not how you talk or smile. This nerve can be affected during or after wisdom tooth removal due to trauma, similar to hitting your funny bone. You may feel tingling or even experience temporary or permanent numbness. Here's how the risk increases with age. At 15, the risk of nerve injury is less than 0.1% because the roots are still developing and far from the nerve. Around 20 years old, the risk increases to about 10 to 20%. At 30, it rises to 30%. At 40, it can reach 40% and continues to increase with age. These are general estimates, but the main idea is, the older you are, the more difficult the healing and the greater the risk of permanent numbness in the lip, chin, tongue, and teeth. When do we recommend removal? That's why, after the age of 25, I usually do not recommend removing wisdom teeth unless you are in pain, experiencing sensitivity, showing signs of disease, infection, or bone loss. In those cases, we need to evaluate and treat the issue. Problems may include cavities or caries, periodontal pockets, cysts, or other pathology.